The devastating effect of Covid-19 on care homes is being felt in Blaenau Gwent and across the world. And can I congratulate the member for Chipping Barnet on her contribution just now. A quarter of New York's fatalities happened in care homes. 200 people died in just one care home in Italy. In England, a full 16% of care deaths, Covid deaths, have happened in care homes. This is clearly a far-reaching issue. Today, though, I want to talk about a very local tragedy in my constituency. Blaenau Gwent has one of the highest number of cases of coronavirus per head in Wales. A brave care home staff member contacted me to say that early on in this crisis, their care home had inadequate PPE. It was also reported that a resident showing symptoms of Covid-19 was discharged back from hospital and allowed access to communal spaces. Now, I've sought confirmation of this from the health authority, but the exact situation remains unclear. Altogether, 16 residents have died. My question is, were the processes in place so care homes could deal with this crisis? We knew that the coronavirus would hit the elderly and the vulnerable the hardest, that those in care homes were the most at risk. More should have been done at the start of this outbreak to protect residents and staff. Mr Deputy Speaker, this has been a dreadful time for my constituents, for care home residents, their relatives and hard-working staff. I've been raising my concerns on this one issue with a range of local decision makers on an almost daily basis. Now, those decision makers have been pulled in 101 different directions. I know they're doing their very best, but the truth is health officials have had to focus on the NHS, but we've been playing catch-up with care homes. Social care is a vital sector, but we haven't been treating it that way. This crisis has revealed to me that we need to mend the broken structures of accountability, fast action to shield those who are most vulnerable, and daily updates on deaths in individual care homes. There must be an open discussion about these issues, one that respects the rights of residents and the needs of staff. We need to build something better. Mr Deputy Speaker, I want to end by paying tribute to our care workers across the country who are putting their lives on the line. Now, I've been lucky enough to visit many of these care homes over the years. I know that, at their core, these are places of love. Mr Deputy Speaker, those cared for are more than residents. They are like family. And for these homes, coronavirus deaths are not just numbers, they are painful losses. It is vital we ensure that tragedies of this scale are never allowed to happen again. Thank you, Mr Deputy Speaker.